Hi, my name is Kristen Plummer, and I work for KV Cap in Skowhegan on the Somerset Initiative. Today we're going to be talking with Danielle Dennis from Somerset Public Health about the issue of resilience and adverse childhood experiences. Danielle, can you just share with us who you are?
Absolutely. Danielle Dennis, I work at Somerset Public Health. I have a background in biology and nursing, and have chosen to work in the public health field. The grant that I work under is a substance use grant, and under the state we also receive some federal dollars to work on some youth initiatives there around substance use.
Can you talk a little bit about the youth initiatives?
Absolutely. So the Healthy Maine partnerships were absolved as we know them, and there was some restructuring that went on, and so there were 3 vendors that were chosen throughout the state to kind of oversee the work at the local levels. Reddington Fairview, which is our parent corporation, received some funding for that, and so we are identifying and working on underage drinking, or trying to address underage drinking, opiate and heroin use, and also marijuana use. And we get federal dollars from drug-free communities under a Sober Truth on Prevention, a STOP grant, to address the underage drinking at our local community level.
Perfect, thanks. What other things does Somerset Public Health do? Can you just give us sort of a brief overview of what services they provide in the community?
In our little tiny office, there's anywhere between 12 and 16 of us, and we do everything from substance use to tobacco, which are 2 separate things, at least in the funding world. Nutrition education. We also house some AmeriCorps volunteers who are working on case management and the elderly and aging in place. We're working on some the aging population, and trying to bring those folks together. We live in a county that has over 50% of 65 and older, and trying to address some of their needs as well to help them age healthy at home.
Perfect, thank you. So you talked a little bit about where your funding comes from, some of the issues that you're addressing. Can you talk specifically about some of the ways in which you're hoping to have that happen?
Yes. Through our funding, we've been able to fund a school resource officer in some of the schools to kind of help with some of the school-based initiatives. We're providing, we work a lot with evidence-based programs, so Prime for Life, which is the same program or curriculum that they use in the DEEP for folks that have an OUI offense, and so it helps young people, at least in my world, it could help anybody, but it helps young people identify how their choices can either protect or put at risk the things that they value most. We're also looking at the idea of adverse childhood experiences and the antidote to that, which is resilience, and how those things affect the long-term health outcomes of folks, including substance use. What the research is showing us is that folks with an ACE score of 4 or more are 4 times more likely to have a problem with alcohol, and the same is true kind of across the board with illicit drugs and marijuana and some of the other substances that can help kind of numb the pain and be effective coping mechanisms. And just because they're effective doesn't mean that they're healthy, but they certainly are effective at doing that. So this year, what we're kind of trying to do is to strengthen the community capacity around some of these initiatives, and expand the opportunities of enhancing resilience and amongst our young population.
Perfect. And so just thinking about, what does substance use look like with teens and young people in Somerset County? What are the trends? What are you seeing?
So we initially got a drug-free communities grant back in 2009, which is also when they started implementing or doing the main integrative youth health survey, which is also shortened to MIHAS. So if I use that, that's what that
That's
means.
what that means.
That's what that means. And so we've seen this downward trend with all of our substances: cigarettes, alcohol, marijuana, prescription drug use, binge alcohol, and inhalants. And so the trends are going down, and that's the good news. However, we still have a lot of work to do. I have my little cheat sheet here in front of me. But this is, so the data that I'm providing is from the schools that we service. So Jackman, Bingham, Carabec, Madison, and Skowhegan are the 5 schools within our quote-unquote service area. And they're telling us that the past 30-day use, which is also considered current use of alcohol, is 24%. So that's 24% of our high school students that are reporting current use of alcohol. 30-day current marijuana use is right around 20%. So we've got 1 in 5 kids that are using currently. Lifetime use of alcohol is at over 50%. So 51% of our students have reported at some point in their lifetime that they've used alcohol. Marijuana is right behind that at 36%. So we're still seeing patterns of usage that are at least alarming to me and concerning to me, and certainly indicate that that there's something that's that we could possibly help with. And we also look at perceptions. So whether or not they believe that there's a low perceived risks of harm from doing these, from participating in these activities, and so the amount of kids that are stating that there's a low perceived risk of harm from drinking 1 to 2 drinks every day is 41%, and certainly for you or me, drinking 1 to 2 alcoholic beverages a day is low risk, but for their developing minds, not so much.
Right. Things change depending on age and where your brain and body is in your development.
Absolutely.
So, and I just want to point this out because I don't know sort of how to. I think we focus on the 1 in 5 have used, but 4 in 5 have not.
Correct.
So if we think about the larger percentage, sometimes we get stuck in this place of, like, you're using and you're my friend, so it makes it okay for me, but really 4 out of 5 kids are not using. So how do we...
That's one of the things that I personally struggle with as I'm reading off these, some of these statistics, and trying to move away from the deficit-based conversations that we're having and more towards the strength-based conversations. So, 51% of our population. When you start getting to the over 50%, it starts to become a little bit hard because you do have the trends or the majority that are participating. But for the most part, the current cigarette use, we've got 89% of our students that aren't using, and so certainly there is a need for myself and others within my that have the ability to get the information out there to do so in a way that shows that this is not the norm, and that a majority of their peers are not participating for sure.
And there is community strength somewhere in this, some support. So that sort of leads into my next question is, what are teens, do you ask teens, what are they saying about use? Why are they using? How is it available to them?
We, one of the Prime for Life curriculum is used in a multitude of ways, so not just the DEEP program or even in a universal prevention curriculum, but we also, one of the high schools, it's called the CERT class, so Student Intervention Reintegration Program. It's a mouthful. But for students that are caught in violation of their substance policy, they can choose to take the CERT class, which is 12 hours, so 2 full days, instead of suspension. And so we do have the opportunity to speak to some kids that have been caught, who we know are using, and the things that they're telling us are probably not that much different than what we might suspect, though they do go a little bit deeper, and when you hear it from the kids, it certainly does tug at your emotional heartstrings, that they're using to kind of numb the pain, to get away from things. They're using because it's the norm within their household. They're using with their parents. And in the class that I had last time, we did have 8 young people, all of whom told me that somebody from their family, either a sibling or grandmother or aunt or parent, had provided them, given them the substance that they were using, which is slightly alarming. Kids look to their parents as a source of information and as a source of providing them with some structure in life and understanding what's right and wrong. And when the substances are coming from those people, it certainly does send mixed messages. The hope behind that is that they are good kids, and they don't want to fall in the same footsteps as their parents. They certainly, in some cases, not all of them were there because they have parents who, at least from the periphery or from a perspective, could possibly very well have a substance use disorder, but they don't know how else to cope with the pain that they are feeling on an emotional level.
Absolutely, and I think it's important, you just said this, important, that just because a kid is using drugs or alcohol does not make them a bad person. So yes, thank you for that. So can you talk a little bit about, why is it important through your work to support families and children around substance misuse or substance use or resiliency?
Well, I think it's really important for the communities to support our young people because for various reasons, whether or not it's the parent is using and unable to provide the direction or the parenting that they would probably like to be able to provide but are unable to, or because of financial circumstances, they are forced to work at times where they'd like to be home for their kids. But it's really important as a community that we start looking at as our young people as all of our kids, and to model the behaviors that we'd like them to show. One of the last class of students that I worked with in the SERP class, I asked them what kind of reaction they thought I got when I told people that I worked with young people and teenagers mostly, and a couple of them rolled their eyes themselves and they said, "Oh, I'm sorry," or "Really, why would you choose to do that?" And that's not always the response that I get, but certainly there are some people who, when you tell them that you're working with the teenage population, that they kind of like, "Are you crazy? Why would you want to work with them?" But the kids know this, and they perceive this, and they know that that these types of perceptions are going on, and they find it very difficult to respect us as adults when they're being looked at as, turds or whatever, just because of their age and what people perceive that they could or could not be doing. And so for myself and you and everybody else, it's just really important to give these kids our time and to look at them as adults, because they are the future, and even just a smile or a hello in passing can mean so much to these kids.
Absolutely. Teens are fun. They've got energy, they're funny, they're smart.
They're ingenuitive. Those kids that I had in that class could easily rule the world if they just took their own stories and they learned how to refine them and to find the strengths in their behaviors, because the very things that get them into trouble are also certainly the things that could help them thrive and succeed later in life. Our entrepreneurs exhibit many of the same qualities and characteristics that a person who could get easily caught up in a bad way. So it's just helping them refine their story and find their strengths, for sure.
Great. So let's talk about resilience. Maybe can you just talk briefly about adverse childhood experiences, and then we will talk about the importance of resilience.
So adverse childhood experiences are a number of, and I might have to resort to you, because you were the one that brought me in 3 months ago and dragged me to a Maine Resilience Building Network meeting and sucked me in. But there are a number of things that fall either under abuse, and it could be something that they experience or something that they witness. But really what the trauma piece is about is anything that happens to them within their life that they have a hard time dealing with or coping with, or the emotions become very difficult. So abuse, physical, emotional, missing one, physical, emotional, verbal, abuse, as well as drawing a blank here.
Parental incarceration, parental
Divorce,
substance misuse, divorce, sexual abuse.
Yes, yeah, that's the other abuse that I was missing. So, certainly the use amongst parents, or what they're witnessing within their home, whether it's violence or onto themselves or to their mother or to another family member that they're living with. So those are the ACEs, and what we're seeing. Some folks did a study back in '95, the early ACE study, with a group of 17,000 participants, mostly white, middle class, insurance carrying people, was that ACEs were common, that but that more importantly that they are the best predictor of later health problems in life. So everything from heart disease to cancer to substance use. Like I mentioned earlier, that a ACE score of 4 or more puts you at a much greater, 4 times higher risk of developing a substance use disorder with alcohol. So it affects everything, as well as obesity. You're 55% more likely to be obese. So we're finding that these ACEs and the experience of them are a really good predictor. And I should probably say that just because you have an ACE score of 4 or more does not mean that without a doubt that this is your destiny. It's just a predictor, and if we can predict it, then we can prevent it. So this is really kind of a new way for us, anyway, within our county, to start looking at substance use and early onset of use by our kids. And my hope is that if we can build a more resilient community, a more trauma-informed community, we can help break some of the intergenerational cycles of use, of violence, to help ourselves, our children, and our community at large just be a healthier place to live.
Absolutely. So let's talk about resilience. So there are adverse childhood experiences, which are sort of these are all the, potential bad things that could have happened, traumatic things that could have happened to you, and these are the results. So then the other piece is resilience. So we know that just because these things have happened to you does not mean that, and I think it's similar to what we talked about, like 1 in 5, there's a 1 in 5 chance, but 4 out of 5 of you will not do this. And so, talking about putting in place protective factors for young people and families. So can you talk a little bit about resilience and what that is and how it sort of sort of a protective piece around adverse childhood experiences.
Absolutely. So one of the early founding fathers, if you will, of the ACE study, Dr. Vincent Folletti, when he talks about toxic stress as being a kid or a person who has been caught up in the cycle of stress and isn't constantly in this fight or flight mode. And so in the movie Resilience, they did this really beautiful animation of a kid who was walking across the street, and the large Mack truck is coming at them, and you need to have that fight or flight response in order to get yourself to safety. But what happens when we are constantly stuck in that, when you constantly feel like that bus is coming at you because of your environment or mostly things that are going on around you, it has an effect on your development, on your neurological development, on your nervous system development, and can hinder your emotional that's what I'm looking for here,
Development.
competence and those types of things. So one of the things that Dr. Folletti said that you absolutely must not have in order for you to experience toxic stress is that you can't have any supports. So when he talks to people who state that they're living in toxic stress, he'll ask them, do you have somebody that's supportive of you? Do you have somebody that you can talk to? And if the answer is yes, then you're not experiencing that toxic stress. Mm-hmm. So at the very core of resilience is just being a support to each other, and whether that's our own kid or the neighbor or anybody else, but building the connections and building support networks. And I'm not even quite sure I answered your question here.
Oh, absolutely. Well, I think that, that's a great example that, you're living in toxic stress. You have no concrete supports. You don't have someone you can call and say, hey, my car broke down. Can you give me a ride to the grocery store? Hey, I don't have food and I need to access food. So when you are sort of stuck in this place of toxic stress without any help, without anyone who can provide that place of protection or resilience, then it becomes toxic stress. If not, if you can call your friend and say, listen, my car broke down, I need a ride, and they can come and provide that for you, that looks different, and that's resilience. It's being that one person or multiple people to support you.
Yes, connections, the human connections. And I think that a lot of times, especially in my world of the nonprofit, we get really stuck on, when we talk about resources, we think about the almighty dollar, and we fail to look at our human capital as a resource. And I think that I personally think that that's an untouched and untapped resource, or largely untapped resource, that we have some amazing human capital within our area, and that people do want to share, and they want to share themselves, and they want to share with others, and they just don't know how to do that. And it's big shoes, but I'd like to try to figure out how we can all capitalize on that for the better.
Absolutely.
For sure.
How cool would that be?
Very.
So just a couple more questions. We talked about resilience, and I think we talked a little bit about why it's so important. It creates that protection for folks. Like, okay, so I'm not standing here alone. I have people I can call on. And we talked a little bit about that human capital, but what can individuals do to create and build resilience? What can a community member, so someone who's watching us talk about this, what are some things that people can do to help create resilience in a community or with the people in their lives?
The first piece is really kind of understanding the ACEs. So, and the original study had 10 on there, and it's not an exhaustive list. And again, it kind of goes back to the whole trauma piece. And if there's a situation in which a person is having a really hard time digesting and living with, then that's trauma. And so identifying our own bits of trauma, and where we might, I don't want to say fall short, but where we could improve, or identifying, or just putting a name sometimes to those things helps, because if we name things, then sometimes we're not going to be as fearful of them. And helping others also, so building an awareness around the ACEs, and helping others understand where sometimes their own experiences could be impacting them on the long term, and having that conversation, and then building a community where it's safe, where kids know that there's somebody that they can talk to, and it's a safe place, that they're going to be respected, so that mutual safety and trust relationships, as well as just being supportive to one another. And that doesn't have to be, again, it doesn't have to be financial support. You know, it could be a hug, it could be just shooting that mom that's having a real hard time with her toddler in the store, the look of like, hey, I get you. Like, been there, done that.
Haven't we all been there?
Or maybe not so much intervening, but just being supportive of one another, and showing a little empathy to one another goes a long way. And it just seems like it's common sense, and so I kind of struggle pulling these things out, but it's definitely something that we've gotten away from in our society. Giving kids, or giving people choices, and creating a cultural competence, and those are kind of big words in a 98% white community, or probably even more in our areas, but being aware of the complexities that confront the kids, and maybe not even the kids, but the populations that you either serve or work with, or come in contact with. And we are definitely very rich in adversity in Somerset County. 3 in 4 kids don't live in poverty, but that means that we still have 1 in 4 that are going home, and they don't know where their next hot meal is going to come from. We have child abuse and neglect rates that are 3 times the state average. As far as domestic violence goes, we have almost twice the number of calls as the state average. So we certainly are rich in adversity, and if we could just look at that through a slightly different lens, and help those people who have lived those experiences refine their story, and their strengths, then that can go a long way.
Absolutely. And I think that's such a great, like, it doesn't have to be something big, because I think sometimes when people think about things like adverse childhood experiences or how to create resiliency, we think sort of as the whole issue, and it's, you know, we can easily break it down to some pretty simple connections in the community. You know, we all, or most of us, go to the grocery store, or most of us go to the gas station, or most of us, you know, have some sort of interaction with other people in the community on a pretty regular basis. So to just have those human moments is pretty significant.
Being patient, and recognizing that sometimes the people that might drive you crazy are the ones that kind of need you to be modeling behaviors the most. And whether that's talking correctly, or what's appropriate and not appropriate to say in front of children, or just in general, the things that, you know, we really don't need to hear all about people's quote unquote dirty laundry 2 blocks away, but just modeling those things to one another, and being patient.
Absolutely. Sounds like a pretty nice world.
I think so.
So I have one more question. I don't know if there's anything else you want to add, anything that you think is important for people to know.
Well, going back to the MIHAS piece, And there's lots of information that can be found on maine.gov. If you look up MIHS, MIYHS, the Maine Integrative Youth Health Survey, and it'll take it down by county, so you can look up Somerset County and what the youth are telling us. And there's 189 questions on there, so certainly I don't have the time to go into all of them. But the one that kind of jumps out at me that I think that we as a community can certainly get to is that when these youth were asked whether or not they felt like they mattered to people in their own community, 45% of them said yes, which means that 55% of them don't really feel like they matter at all to community. And that's something that we can all collectively address. And again, it's just those little small acts of inclusion, small acts of kindness. And these kids would love, for the most part, to help. They just need to be given some direction and some guidance, and just to feel like they're people too, because they are, and they're a future. And they'll do this every 2 years. They'll do it this year, and I'd love to see in 2019 if we can all work collectively to do something about that, and get our youth to feel like they matter, and that they have something to contribute, because they do.
Yeah, that's pretty heartbreaking. 55% of kiddos in this community don't feel like they matter. You really let that sink in. So last week at Skowhegan High School, there was a showing of the movie Resilience, which is, and please help me describe what it is, but it's a sort of figuring out a community response to adverse childhood experiences, and what the medical community can do, the social services community, education, what sort of they all can do collectively to address the issue of resilience and adverse childhood experiences. And it sort of breaks it down so it doesn't seem so big. Like, okay, so I can do this part. It was a great turnout, great conversation. If other people in the community want to see Resilience, do you have plans to show it?
We don't have any dates yet,
Okay.
but there's certainly plans in the works. I've been working with Madison and Carabec to get viewings within both of those communities. And when I do get those dates down, they will be on our Facebook page, a Somerset Public Health. And we did a press release that was in the Morning Sentinel, and sent that around. It would also, not really within my area, but there's been discussion about showing it in the Heartland area as well. And I'd like to get to Bingham and Jackman. Haven't opened up those conversations, so if you know anybody there, shameless plug, call me or reach me by email, and certainly if there's anything that any of the viewers feel like they could contribute, as we talk about human capital, or even just ideas. You know, part of this is about getting the information into the hands of the majority of the people who can come up with their own really ingenuitive ways of tackling this. And we all know our communities better than all the professionals in the world, and we collectively are going to be the ones that will need to sit down and really break it down to come up with how we can break these cycles.
Perfect. So we'll make sure that at the end people have your contact information, so if they want to reach out and get more information about resiliency, more information about where and when the next viewings of the movie will be, or anything else about Somerset Public Health, they will know how to get in touch with you.
Thank you.
All right, thanks for joining us.
Absolutely. Thank you, Kristen, very much for having me.
All right.